If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me for another episode of My Story Living with Lupus podcast. I'm your host, Susan Hendricks, and I'm so glad that you could join me on this Friday, October 9th, 2020. We know that the formation of healthcare insurance was established on July 16th, 1798 by President John Adams. He signed the first federal public health law, an act for the relief of sick and disabled seamen. Now, this assessed every seaman at American ports 20 cents a month. This was the first prepaid medical care plan in the United States. And by that, you know where I'm getting ready to go with this. This episode is about Rona and pre-existing conditions caused by Rona. It's about the election and what it all means. So, you know what I want you to do, all the way from the United States to Australia. Grab your cup of coffee, your cup of tea, and to those who are listening late at night, you know I appreciate you. So grab your favorite glass of wine and come on and join the conversation right here on My Story Living with Lupus podcast. We all know the benefits of apple cider vinegar. Now, you guys know that I'm a vegan and that I have lupus along with other health issues. I used to take ACV every morning before I worked out, but eventually the taste of ACV got to me and I had to look for another alternative. And that's when a friend of mine turned me on to Goli. Goli is the first apple cider vinegar gummy. They give you all the benefits of ACV without the taste. That's right. Goli is vegan, gelatin-free, gluten-free, and 100% organic. And the vitamins and the ACV in Goli promotes a healthy heart by maintaining a healthy cholesterol range, controls blood sugar levels, and also curbs your appetite. And the best part about Goli, for every cell generated, a child in need receives a 6-month supply of essential vitamins with Vitamin Angels. So, if you don't believe what I'm saying, I'm going to give you some information so you can try Goli for yourself. Here's a promo code you can use. It's SUELYN1. That's SUELYNNE1. And you'll receive 5% off of your initial purchase. Also, I'll leave a link in the description in the podcast. So, why don't you go and try it for yourself? You won't believe how good it tastes. That's Goli. Thank you for joining me back. As I stated in the introduction of this podcast, if you didn't know, we know that the formation of healthcare insurance was established on July 16th, 1798. President John Adams signed the first federal public health law, an act for the relief of sick and disabled seamen. This assists every seaman at American ports 20 cents a month. This was the first prepaid medical care plan in the United States. The fight for health care for all is nothing new. It has been going on for decades. But I need for you to understand the history of this. So I want you to listen closely to this. During the Progressive Era, President Theodore Roosevelt was in power, and although he supported health insurance because he believed that no country could be strong whose people were sick and poor. Most of the initiative for reform took place outside of the government. Roosevelt's successors were mostly conservative leaders who postponed for about 20 years the kind of presidential leadership that might have involved the national government more extensively in the management of social welfare. In 1906, the American Association of Labor Legislation, better known as AALL, finally led the campaign for health insurance. They were a typical progressive group whose mandate was not to abolish capitalism, but rather to reform it. In 1912, they created a committee on social welfare, which held its first national conference in 1913. Despite its broad mandate, the committee decided to concentrate on health insurance, drafting a model bill in 1915. Well, in a nutshell, the bill limited coverage to the working class and all others that earned less than $1,200 a year, including dependents. The services of physicians, nurses, and hospitals were included, as was sick pay, maternity benefits, death benefit of $50 to pay for funeral expenses. This death benefit becomes significant later on. Costs were to be shared between workers, employers, and the state. Well, in 1914, reformers sought to involve physicians in formulating this bill, and the American Medical Association, better known as AMA, actually supported the AALL proposal. They found prominent physicians who were not only sympathetic, but who also wanted to support and actively help in securing legislation. In fact, some physicians who were leaders in the AMA wrote to the AALL secretary stating, quote, "Your plans are so entirely in line with our own that we want to be of every possible assistance," end quote. Now, by 1916, the AMA board approved a committee to work with AALL, and at this point, the AMA and AALL formed a united front on behalf of health insurance. Times have definitely changed along the way. You know, in 1917, the AMA House of Delegates favored compulsory health insurance as proposed by the AALL, but many state medical societies opposed it. There was disagreements on the method of paying physicians, and it was not long before the AMA leadership denied it had ever favored the measures. Then comes along in 1917, the U.S. entered World War I, and anti-German fever rose. The government commissioned articles denouncing German socialist insurance, and opponents of health insurance assailed it as a Parisian menace, inconsistent with American values. Other efforts during this time in California, namely the California Social Insurance Commission, recommended health insurance, proposed enabling legislation in 1917, and then held a referendum. New York, Ohio, Pennsylvania, Illinois also had some efforts aimed at health insurance. But in the Red Scare, immediately after the war, when the government attempted to root out the last of radicalism, opponents of compulsory health insurance associated it in a manner that was buried like an avalanche of anti-communist rhetoric. This marked the end of the compulsory national health debate until the 1930s. Fast forward to today, the fight continues with both sides of the aisle going back and forth. But there exists one argument which one side of the aisle remains adamant about. It is those who have pre-existing conditions. One side of the aisle wants to take away coverage to those who desperately are in need of keeping their insurance through the Affordable Care Act. Some call it Obamacare. Stay with me and we'll go further into this. You know, those of us with lupus experience hair loss, thinning hair, either from the illness or the medication we take. I have this perfect solution for you. It's called Vitalize. Yes, Vitalize can help you. They are in the business of growing healthy hair. They have a hair system that can help you, and even better, they have a new and improved edge control gel. That's right, ladies. There is no flaking. It lays down the edges and also protects it from heat. But wait 1 minute. Most importantly, the edge control has the award-winning hair growth ingredient retinol. Addition to the 3-part scalp treatment system, there is a silk pillowcase for you to lay those growing locks on. Shampoo, conditioner, and multivitamin gummies. You can see reduced shedding in 2 weeks. You heard me. And most see results in 4. To see proof for yourself, go on over to Vitalizehair.com. That's Vitalizehair.com and use the referral link listed in the information box on this podcast. All right, and we're back. Now, fast forward to today, we're talking about the Affordable Care Act, formerly known as the Patient Protection and Affordable Care Act, and commonly known as Obamacare, is a United States federal statute enacted by the 111th United States Congress and signed into law by President Barack Obama on March 23rd, 2010. together with the Healthcare and Education Reconciliation Act of 2010 amendment, it represents the U.S. healthcare system's most significant regulatory overhaul and expansion of coverage since the passage of Medicare and Medicaid in 1965. So one thing I want you to understand, health care is not, well, it should not be a privilege. It is a right. And what's going on today, they would have you to believe that it is a privilege. But in actuality, it is our right. Now, the ACA's major provisions came into force in 2014. By 2016, the uninsured share of the population had roughly halved, with estimates ranging from 20 to 24 million additional people covered. The law also enacted a host of delivery systems, reforms intended to constrain healthcare costs and improve quality. After the law went into effect, increases in overall healthcare spending slowed, including premiums for employer-based insurance plans. The increased coverage was due roughly equally to an expansion of Medicaid eligibility and to changes to individual insurance markets. Both received new spending funded through a combination of new taxes and cuts to Medicare provider rates and Medicare Advantage. Now, several Congressional Budget Office reports said that overall these provisions reduce the budget deficit, that repealing ACA would increase the deficit, and that the law reduced income inequality by taxing primarily the top 1% to fund roughly $600 in benefits on average to families in the bottom 40% of the income distribution. Now, before and after enactment of the ACA faced strong political opposition, calls for repeal, and legal challenges. In National Federation of Independent Business versus Sibelius, the Supreme Court ruled that states could choose not to participate in ACA's Medicaid expansion, although it upheld the law as a whole. The Federal Health Exchange, healthcare.gov, faced major technical problems at the beginning of its rollout in 2013. Polls initially found that a plurality of Americans opposed the act, although its individual provisions were generally more popular, and the law gained majority support by 2017. The law caused a significant reduction and the number and percentage of people without health insurance. The CDC reported that the percentage of people without health insurance fell from 16% in 2010 to 8.9% from January to June in 2016. The uninsured rate dropped in every congressional district in the U.S. from 2013 to 2015. The Congressional Budget Office reported in March 2016 that approximately 12 million people were covered. I'll say it again. 12 million people were covered. So that goes to tell you, before then, you had 12 million people who did not have health care insurance. And these could have been people working every day, but they could not get or afford health care insurance. The uninsured rate dropped in every congressional district in the U.S. from, as I stated, 2013 to 2015. Now, 12 million people were covered by the exchanges, 10 million of whom received subsidies, and 11 million added to Medicaid. Another million were covered by ACA's basic health program for a total of 24 million people. Now, CBO estimated that ACA would reduce the net number of uninsured by 22 million in 2016. Now, using a slightly different computation for the figures that was just stated, ACA coverage of 26 million less 4 million for reductions in employment-based coverage and non-group and other coverage. Now, since this passage, you had individuals from across the aisle, Republicans, have voted to repeal all or parts of the Affordable Care Act more than 60 times. Do you think that they are holding or are interested in the well-being of the people? If you want to repeal it more than 60 times, look, we are living in a time that half of the United States are in a position to have this coverage taken away. Just think about it. We are in a pandemic where 210,000 individuals have lost their lives. And you are stating that you want to take away the Affordable Care Act because it is no good? Or is it due to the name that is attached to it? Of course, with everything, you're going to have good, bad, and indifferent. But why not work together with the other side of the aisle, Democrats, and expand on making the Affordable Care Act better? But what they consider no good have saved, has helped so many who suffered from pre-existing conditions that were not able to get insurance coverage through other providers based on having that pre-existing condition. Do you know the number of American people who live with pre-existing conditions? I want you to take this information that I'm about to give you, and in the words of Country Wayne, allow it to sizzle deep down in your spirit. 54 million individuals live with pre-existing conditions. That's right. Is it sizzling? Or has it begun to sizzle in your spirit? Or is it at the marinating point in your spirit and it hasn't begun to sizzle with you yet? Now, between a coronavirus pandemic that had infected 7.5 million Americans as of Thursday, and a high-stakes Supreme Court case just weeks away, health insurance for the people with pre-existing health conditions is on the minds of many. Look, the ACA outlawed health insurance carriers from increasing prices or denying coverage for people due to their pre-existing conditions. And I'll tell you a story. And this story is about myself. I was working one day and I always worked in the medical field. And I had the doctor of this medical practice come to me and told me, Susan, you're a liability to me. Now, this is what you can do. I'll cover you, but I would have to charge you over $900 in health insurance coverage. So I sat there and I said to myself, this fool just told me I'm a liability. I said, okay. I'm steady talking to myself so I would not blow up. I said, let me think about it. Now, by the time I got off of work, I went by to see my mother. My mother was bedridden, but she was still able to converse with me. And I said, Mama, I said, you know what this fool told me? And she said, what? I said, told me I was a liability due to my pre-existing condition of lupus and everything else that was going on. I was a liability. And she said, well, what you gonna do? I said, you know me better than I know myself. She said, I thought so. She said, you do what you have to do. And I did. I never went back since I'm such a liability. And I'll say it now, and I left you in a hole. You didn't know what to do or how I did what I did to make that practice progress. But I was a liability due to my pre-existing conditions. Yeah, right. And you know what? That next week, I was covered by Blue Cross and Blue Shield. Yep, I said it. I was covered. Yeah. Blue Cross and Blue Shield covered me. Now, so has anyone truly thought out this whole process that has been promised by the current administration? Now, look, I'm going to break it down to you like this. Those who have contracted COVID-19 will more than likely end up with what I call residual side effects from this virus, which in turn will leave said individual with a pre-existing condition. Now, how will said individual with a pre-existing condition receive medical treatment and care? Will said individual continue to have health insurance, or will the health insurance company drop that said individual's coverage? And since those who are in office wants to repeal the ACA and replace it with what? Now, we have been waiting for 4 years for an answer to this, among other things. Those who contracted this virus are left with the feeling of being alone and afraid. And now some will have to deal with what I call residual side effects, such as heart issues, lung issues, and God knows what else, due to the incompetency of the current administration and their lack of compassion and empathy for the people in these United States. Yes, it's time that this situation should be sizzling deep down within your soul. It is time for you to open your eyes, open your ears, but most importantly, open your mind. People have lost their lives. People who were once considered healthy individuals will now suffer from residual side effects of having COVID-19, which in turn will make them have pre-existing conditions. Anyone that has or haven't, who has, or don't have a pre-existing condition, you should be upset. You should be concerned because we're living in chaos. All we hear are pipe dreams from the current administration, but what we get is chaos. Stick with me, and I'll be back to close out. Well, you know what time it is. Yes, it's time for me to go. But before I go, I want to leave you with this. We as a country have had an administration to mock this virus. We have had an administration to mock wearing a mask. We have had an administration that came into office with an abundance of pipe dreams, and not a single one of those pipe dream ideas have come to fruition. We have had an administration to show us that they will take the word over our adversaries and not the word of our own United States intelligence personnel. We have watched this administration take children from their parents and lock them up in cages. And it's like throwing away the key. Have we forgotten about those children living in those cages? Yes, we have had an administration who encourages and incites vigilante behavior by those who despise others who don't look like them. We have had an administration to come into one of the highest offices of this country and make the White House a hot spot of breeding hate, lies, and let's not forget about a hot spot for the coronavirus. Yes, it is a breeding spot, the White House. And you know, I used to say when that person took that office, I said they're going to have to wind up exterminating the White House. And whoever comes in next will have to wait to open the doors, because it will be infested with hate, lies, and self-serving attitudes. I have never heard or seen anything like this in my entire life. I have never seen an individual who states that they have contracted one of the deadly viruses out here, walk out of a hospital, jump into a motorcade, and wave at his adoring fans. Now that same person who walked out of the hospital walked up the steps to the White House and shot a promo spot, just like he shot a promo site in front of a sanctuary on sacred grounds with the Bible held upside down. This is your time to show up, show out. If you have not received your ballot, get it, because over 5 million people here in the United States has voted. I voted last month. I hand delivered my ballot to the city clerk's office. Look, It's no joke out here right now with the way things are in Washington. Yes, we are the laughing stock of the whole world, with a 3-year-old child set mind trying to conduct business. Yes, this country has been hoodwinked and bamboozled by one of the greatest con men there is. But I say that to say this. Your con game was not that strong. Anytime an individual can bankrupt businesses and then turn around and get elected into the highest office that exists in this country, and then puts this country, we're in a depression, you guys. Let's be for real about it. There are people out here right now that's being set out on the streets from their apartments, losing their homes. Children have to learn a new normal of going to school, of talking to their friends. He has bankrupt and depleted this country to a hilt. He did not know anything, let alone about business, let alone about running a country. Let's be for real. It was all a game to him. But you have the opportunity to flip the script, not only in the White House. You have an opportunity to change what you see in Congress and in Senate. You have the opportunity to change what you see at the local level of government. Yes, you have an opportunity to make a change. Will you open your eyes, your ears, and your mind? We all see what's going on. If anyone wanted to come into this country right now and attack us, they have the opportunity. Do you really feel safe? Do you really trust an individual who knew about this virus and stated he did, but he did not want to panic the people? But then he turns around and said, I didn't say that. There exists a problem, you guys, and the problem is sitting in a house. Well, I should say this because it is our house. He is sitting in public housing, receiving a check from the public, and the public is taking care of him and his family. And he's having a Twitter frenzy about he doesn't want to debate if it's virtual. He's not showing strength. He's showing that he is a spoiled little boy who can't have his way. So what does he do? I don't want to play anymore. This is not a game we're dealing with. This is reality. We are not a reality show. But I wouldn't be surprised if he doesn't have cameras filming everything that's going on now, and it'll be on TV. Donald Trump's White House. Yeah, I said his name. But it's up to you. Do you want 4 more years of what's going on? Do you want to lose what insurance coverage you have through the Affordable Cares Act? Hey, it may not be perfect, but you can elect people into office. Oh, wait a minute. Don't say your vote doesn't count. I heard that. It counts. It counts. And it counts dearly right now. Look, it's a lot of people who have fought, marched, and been beaten for the right to vote. Think of George Floyd, Breonna Taylor, Ahmaud Arbery. The list goes on. Please get out and vote. Show up and show out. This is serious. We cannot take 4 more years of what's going on. I'm Susan Hendricks, your host for My Story Living with Lupus podcast. I'm wishing you a most peaceful, positive, safe, and oh so blessed weekend. Be sure to tune in next week. We have life lessons. Also, we'll be talking about foundations and the different charities out there that's trying to help people within communities. Also, go on over to the mystorylivingwithlupus.com website and shop in our store that is up right now. 100% of the proceeds from each person goes to the Charlie E. and Minnie P. Hendricks Foundation, which assists those with chronic illness by purchasing medication, feeding families, providing school supplies and clothing for children. We would appreciate it if you would go on over and make a purchase so that we can continue to help those in need. Also, the foundation will be feeding the homeless on November the 8th, 2020, here in Michigan. Yes, we will be getting out on the streets and passing out food and clothing for the homeless. Also, I would like to thank those who have donated to our cause of feeding the homeless. I would like to thank Chef Charles for helping the foundation with the food. So you guys make sure you tune in. Please follow us on Instagram, Facebook. Also, please go on over to YouTube and like our YouTube page and show us some love. We're trying to do something that is helping those who are in need, who have pre-existing conditions. You know, the ones who have to make a choice. Either I buy food for my family or purchase my medication. That's what My Story Living with Lupus and the Charlie E. and Minnie P. Hendricks Foundation is trying to do and is doing. Now, it just popped up that there was an attempt on Michigan's Governor Gretchen Whitmer kidnapping. Yes, someone tried to kidnap our governor, Big Gretch, but they failed. So I'll see you guys next week. Don't forget to tune in each and every Friday. Also, go on over to mystorylivingwithlupus.com's website and peruse through the store and help us help those in need. I'll see you next week. Like us on Facebook, Instagram, Twitter, and go on over there and show us some love on YouTube. I'm Susan Hendricks once again. It's been my pleasure. And as always, I thank you. I'll see you next week.